The people in my country feel that they have been forgotten by the world. And they ask me, where is the world? Where are the people? I would like to be able to give them an answer. I don't think of my work here as an accomplishment necessarily. I feel like a mother who is looking after her children. It's a privilege that I have been given, thanks to my husband, to be able to live in a country with beautiful people who had the misfortune to have a conflict for the last 10 years. I'm very grateful to be here. Thanks to my husband, we have come home. Thanks to the people in our country who want us to come home. And thanks to the new government who believe that we belong at home. We are feeling very privileged, my husband and I and our children, to be in a beautiful country with beautiful people. I'm feeling very sad of what I've seen in our country. I've been helping my country for over 10 years. And I've been going to Bosnia, I've been going to Kosovo, to Serbia. I've sent aid to Croatia, I've sent aid to everyone because I believe there are no borders in suffering and that we need to have respect for, regardless of religion or ethnic origin, for everyone. When we arrived, I've created the Princesa Katharina Foundation. The purpose of this foundation is to bring awareness around the world of our needs. And we have been traveling throughout the country, visiting hospitals and institutions to identify the needs. Now we know what they need. Now it's time for action.
We're now in a mental hospital in Gornja Toponica, which is a town just outside Niš, about 15 kilometers north. It's the biggest mental hospital in the Balkans, built in the 1920s. The buildings are still 1920s, of course. We first came across it in 1995 when Princess Catherine was here. She had some pictures taken. The pictures came back to England. My first impressions of the wards will probably stay with me forever, I think. The first ward we went into was about 20 feet square, probably. And there were 50 men and women in there. They were naked. They were paddling in their own urine. The place stank. It was the middle of winter, so it was cold. And you had the choice. You open the windows and get some fresh air, and the patients get pneumonia, or you breathe through your mouth, because that's the only way I can cope with that kind of smell. And so today, we've got the great pleasure and privilege of opening up D ward, which has not been used for the last 5 years, because even by Yugoslav standards, it was not fit for humans.
I was appointed the official coordinator from the Yugoslav government, Serbian government, and I have been asked to look after the people in our country and what their needs are. And I've done that. But what I've seen in my country has made me very sad because there are hospitals who need desperate help, social institutions who are desperately needing help. But I can tell you that right now, I think we are at the point where we need to replace the old equipment which are not dependable anymore in the various hospitals. I was in a hospital recently and there were 150 babies. Among them, there were babies in incubators, premature babies. And there was a situation where there was a respirator that was failing and the baby was turning blue. And there was a doctor lady who had tears coming down her eyes, pumping, trying to give life to the baby. She said to me, who am I to decide whether this baby should live or not? Because if she stopped pumping, the baby will die. So we need to make sure that every life has a chance.
If we talk about, let's say, equipment, monitors, heart-lung machine, and all these things, We need everything. This is an emergency situation, and we are not expecting that in the next few years will be possible for our economy to give a good opportunity for our people to have a good health system, especially for the high-level medicine.
According to the latest reports of European Agency of Reconstruction and according to the list of items and medical equipment that is situated in hospitals today, the most needed are anesthesia units and incubators. It is not that matter of number as much as a matter of the fact that this is life-saving equipment. That these are machines that, if not in the hospital, when the time is, someone's life will be lost forever.
One of the concerns I have is looking at this situation here with our laundries. This is a Mother and Child Institute. We got 12,000 children that are coming to be treated here, and this is the machines that our children's clothes are getting washed. All these clothes have been washed of the children. Now you can imagine that this clothes will now go into the newborn babies' bodies, coming out of this here. So this is hygienically wrong. We need to do something about it. I don't think that these conditions can continue. I think we're in an emergency situation now. In our hospitals, we're in an emergency situation. In our institutions where we really have to focus on the needs of the people in our country. In order to achieve these results, the Princess Katharina Foundation had an incredible weekend at the White Palace, which was a special event, opening it for the good of the people, the way my husband wanted it to be. And we have invited friends from around the world to come and to bring a check payable to Siemens, to Draeger, to Hitachi, for any medical equipment, or to write a check to Citroën, to Fiat, to Mercedes for an ambulance. What I believe the country needs the most right now is people who are coming here who would like to focus on the needs of the country, not only from the social sector, not only from the health sector, but on the investment sector.
We have a great need to improve our situation in the health system, and it's not possible only to finance these needs from the budget. So the idea of the royal family to somehow join the efforts in the humanitarian aid and the business is a very good one.
In order to be a successful businessman, it's good also to invest or offer humanitarian projects. And I think it was a great initiative, Prince Katharina, to do that, since, as you also know, that the situation in hospitals is very, very bad, and we all need to help.
There are people here who are suffering, and it's at the doorstep of Europe. It's not Africa, where there are obviously people suffering. It's not Asia, where there are people suffering. But this is right at our doorstep, where it's easier and more real. It should be more real. And I think people should be helping.
I invite people to come to our country to invest. I invite various foundations, organizations, and individuals who would like to come to see this country build again. We are in the middle of nation building. This is not just a humanitarian support that we're looking for. This is support in every sector. We're needing to build a new foundation. This country deserves a lot more than what it has. Our government is new. Our economy is fragile. Our democracy is fragile. There's a lot of strategy in a word for war, but we don't have strategy for peace. This is the moment to create strategy for peace. This is the moment to invest in peace.